Pandemics are nothing new to our world. Plagues and epidemics have ravaged humanity throughout its existence, often changing the course of history. An estimated 500 million people from the South Seas to the North Pole fell victim to the Spanish flu. 1/5 of those died, with some indigenous communities pushed to the brink of extinction. As 2019 came to a close, our world changed in the blink of an eye. A tsunami that began in China has made its way all over the world. The waves crashed without discrimination of race, religion, or socioeconomic status. The waves of COVID-19 raced across the world, leaving almost no country untouched, as governments have scrambled to put together plans that will protect their citizens. As we make this update, global deaths have reached 430,000 and 8 million people are infected. As the scope of the virus was becoming clear, Humanity First USA began mobilizing internal teams to create the Humanity First We Care campaign, with the goal of helping those most affected. The World Health Organization declared a global pandemic on March 11th, and a call for volunteers was sent out to reinforce the existing volunteer task force who could serve during this outbreak. People came in droves to sign up and help, and to be part of an organization dedicated to serve humanity. Food insecurity has now become one of the most urgent and immediate needs that must be met in the United States, as millions have lost their jobs and are now facing barriers to access basic resources. Over 1 million meals were provided by launching food pantries across the nation, collaborating with many mosques and food banks to feed the hungry. Where possible, hot meals have been served, and at other locations, groceries and supplies have been distributed to people's homes. $15,000 masks were distributed under our PPE for Essential Workers campaign. We collaborated with the Ahmadiyya Muslim Women's Auxiliary Make a Mask campaign, providing cloth masks to people in underprivileged areas. We collaborated with the Red Cross and Muslims for Life to help in the shortage of blood for these quarantine times. A 12-hour helpline, which is managed by 20 volunteers, was set up. Information regarding the pandemic, medical, financial and legal advice, as well as assistance in accessing food pantries or grocery deliveries, is given through this call centre. Humanity First Student Organisation has been working extensively on the ground to help Humanity First USA in all its various campaigns.
Projects in collaboration with Meals on Wheels and providing meals to senior citizens.
So if you are healthy and strong and willing to volunteer your time to help combat the devastating impact of COVID-19, please register to volunteer today. Thank you.
Globally, Humanity First USA has been working in various countries to help them deal with outbreaks. Thousands of masks have been distributed in Mali, Burkina Faso and Indonesia, along with hand sanitizers, PPEs and food hampers. In Guyana, masks and medical supplies have been distributed at the New Amsterdam prison. Thousands of meals were distributed in Guatemala as volunteers travelled 4 to 5 hours to cities that had people in dire need of food and supplies. Many stories of love and compassion have surfaced from these difficult and tragic times. Oscar, a senior citizen living alone with his dog Rusty, needed food, and through Humanity First and Meals on Wheels, our volunteers delivered meals to him and took pictures of him and his dog. A few weeks later, they revisited and brought along framed pictures of him with his dog, along with masks and meals that he would need. 84-year-old Manzoor Nisar did not know how to help during these times, but wanted to serve and help those affected by COVID-19. She found out that a local sleep centre needed masks for its rotating patients, so she became a Humanity First volunteer and took part in the Make a Mask campaign by sewing the masks herself. And then there was the gentleman from Archie's army who expressed his profound thanks for the masks and donations made to help the homeless in Santa Clara County. There was a lady who appreciated the volunteers working endless hours in the rain to provide food and essentials to the community. She had lost her job and took care of her disabled teenage daughter, an elderly mother by herself. For her, the food drive enabled her to drive through and pick up what she needed without getting exposed to COVID-19. Her thanks warmed the hearts of our volunteers. These stories are just a few from the 51,000 volunteer hours dedicated to the service of humanity. Humanity First has launched its first Humanity First USA shop to support the funding of various campaigns and initiatives. Orders are flying in and every cent is going into helping the needy. Doctors for Humanity, an initiative to pair doctors with patients in dire need who do not have health care or cannot afford the plans they're on. Everything we do is only to help and serve humanity. We can't sit on the sidelines and watch our nation suffer by COVID-19 or the aftermath of the brutal killing of George Floyd. We are constantly assessing and finding different ways to empower and create paths for self-reliance for the people of America. Our volunteers are the ones who see someone with broken, tattered shoes, a stranger standing in line for food. And there and then, this volunteer takes the shoes off and hands them over to the stranger to try on. And they fit. These are the volunteers who represent Humanity First. We care.